Assessment starting. I'm Kawana, going to be the RN doing abdominal assessment on you, Miss Sonia. Is that okay?
Yes.
Okay. So we're going to have the patient lay down supine, which she is. First, we're going to examine the contour of the patient's abdomen at 2 different angles. Then we're going to examine the umbilicus area, which it is centered and it is intact. It's not inverted, which is normal finding. We're going to examine for any abdominal aorta pulsations, which I do not see any lesions or scars. She does have a few from previous surgeries. Any dilation of veins or venous patterns, which I do not see any, and that can be a finding for portal hypertension or liver disease. Also, we want to examine the patient's skin color. It should match the patient's face color. In fairer color people, it might be lighter, which is normal. So after inspecting, we are going to inspect for any hernias. So to inspect for any hernias, I want the patient to lift her head up. Good. And we're going to palpate. Usually hernias are around the umbilicus region or in the groin area. So I do not feel any masses. Now we're going to auscultate. With the diaphragm of the stethoscope, we're going to go from right lower quadrant in a clockwise direction to listen to bowel sounds. Okay, the patient has good bowel sounds. Now we're going to assess for any bruits from the abdominal aorta. And we're going to use the bell of our stethoscope to listen. Good. So now we are going to assess percussion. We're going to assess the tone of the patient's abdomen. We're going to start at the right lower quadrant again. And she has normal tone. So now we can assess for any tenderness. And we're going to have the patient lift her knees up. We're going to lightly palpate and we're going to examine the patient's face for any discomfort. Any pain when I touch?
No, ma'am.
Okay, now we're going to have the patient sit up, and posteriorly we're going to check for any kidney pain. So we're going to lift the gown up in the back. We're going to start on the right side. Any pain?
No, ma'am.
Any pain?
No, ma'am.
Okay, and that completes the assessment.